Thank you. If you didn't know, our chief meteorologist, Paul Williams, is a prostate cancer survivor himself. I sat down with Paul to discuss what the president will encounter and that President Biden's treatment will most likely be similar to Paul's. So, Paul, tell me your reaction when you heard that former President Biden had prostate cancer.
Devastatingly familiar. It's devastating in the sense of who wants to ever hear cancer? And especially in that location in a man, which is already something that's kind of taboo in the first place.
Is the president's proposed treatment plan similar to what you went through?
Yes. Yes, it is. Because they're dealing with hormone therapy. Once again, because prostate cancer thrives on testosterone. But also, I had radiational treatments. And since his prostate cancer has gotten out of the prostate, it makes no sense for them to do surgery, especially in a man his age. Okay, so, because you would die from the surgery alone.
So what is he looking at and going through?
He's going to look forward to going through menopause like I did. Night sweat, maybe a little bit of weight gain, you know. I think that he could possibly be dealing with some depression occasionally, because that comes with the ups and downs of the hormone therapy, making it a bit of an imbalance that you're accustomed to. One of the things that I had that really bothered me was that there was just a great deal of soreness that I had to deal with. He's looking at a workable lifestyle still. And he's looking at longevity still, believe it or not, with the hormone. But he's just looking at being very mindful of his moods, being very mindful of his muscle, being very mindful of what he eats.
Why have you made it your mission to basically be an advocate for prostate cancer awareness and research?
Honestly, because it scared the hell out of me. Because it scared the hell out of me. I dealt with heart attacks, and I could deal with the heart attack problems I was having easier than cancer, because, see, with the heart attack, I could at least feel it coming. And Maddie, there was more than one night where I literally was crushed under the fear of dying, and dying a horrible, miserable death. From my point of view, a little bit earlier than expected. So I have to make sure that I'm not afraid to talk about it. I'm already talking to my 11-year-old and 10-year-old grandson about it right now.
What do you want our viewers to take away from this conversation we're having?
We as men just have this mentality that I'll put a little dirt on it and I'll be fine, you know. Prostate cancer is so preventable if you just don't cower against the examination. And even if the digital rectal exam is something that makes you too uncomfortable, go get a PSA blood test. Get a pre-screening. As scary as it may seem, you'd rather know early what's happening, because then you can jump on it and stop it from stopping you. Because if you wait, if you try to put this into a closet and lock it up and think that if I don't acknowledge it, it won't bother me, quite the opposite. If you don't acknowledge it, it will kill you. Had I not been diagnosed by accident, I would not be here in 2025. That's without a doubt.
I have known Paul before he had cancer, during his treatment, and after. And really, until today, I actually had no idea how scary it was for him. If there is one positive in this situation, it's that we can shine a light on a disease that definitely needs more attention.